It's a race against time for the Ministry of Health on its transition into the Social Health Insurance Fund project from the previous National Health Insurance Fund, NHIF. Regulations under the SHIF discussed during a stakeholders forum today was that all households with income from salaried employment are to pay a monthly contribution at a rate of 2.75% of the gross salary. The stakeholders, however, argued that the authority ought to deduct from the basic salary, as the latter would result to double taxation.
This 2.5%, which has already been done on the Act, yes, it is there, but we are saying already it is providing to be done for the whole package of your payment salary. But we are saying that's already a taxed money. This issue where you are doing it is amounting to double taxation, it will still be arising to a court case. So please avoid it. If you avoid it, consider it to be based on the basic salary.
At the same time, stakeholders raised concern over the issue of households that were not salaried, stating that the Social Health Insurance Authority should be able to define the households that should be subjected to monthly deductions.
Means of testing is very important. And then these are unsalaried people, or rather the household. We're trying to understand if the means of testing, duration of means of testing, at what time and at what time. As he already alluded, somebody can be getting this amount at this time as a household and then comes lower.
Officials further questioned the transition process from NHIF to SHIF, saying that there was no use for Kenyans to do a fresh registration into SHIA. They pointed out that NHIF had captured all necessary data needed to transition to the new system. They have urged the authority to ensure the inclusion of union groups of medical practitioners during policy making of the fund, in which they say will ensure that patients undergoing various illnesses are extensively covered.
And I think as health workers, we can sit down and have a representative into this claim management, because then it will give us ease in two prospects: the package you're going to get and quick processing of the package. Because one problem that is there is that you are in the hospital, you are detained because there's delay in processing the payments.
Gertrude Burgay, K24, Nairobi.